With the elderly, I mean, apixaban actually has labeling that if your serum creatinine is 1.5 and you're greater than 80 years of age or less than 60 kilograms, you need to adjust the dose. So, I mean, it's specific for age. You've got to be really careful in your little old ladies. You don't overdose them.
It's the same with pediatrics, but more on the flip side. You know, their volume of distribution, obviously smaller, but they're little sacks of water, basically. And so it does affect your pharmacokinetics. But the nice thing about pediatrics is pretty much every drug's weight-based dosed. And so it seems like they're a step ahead than the adult population is.
On the flip side, if you take a drug like warfarin, and we always say start the elderly or anybody greater than 65 at 5 milligrams a day instead of 10 milligrams for loading doses, and even that sometimes it'll push it. I've seen a 75-year-old walking around with 20 milligrams a day on her because it's more liver issue versus age issue. And so while we do say, okay, watch age on things and kind of start low and go slow on it, there are some drugs that age doesn't make a difference even though we think it does. So it just depends on the patient.
Every patient handles things a little bit differently. Every patient's going to have different signs and symptoms. They're going to require more or less drugs. So common things happen commonly, but there are always outliers.